Have you ever wondered why dairy cows sometimes produce less milk, or why their milk quality decreases? One of the main culprits could be coliform bacteria, a group of bacteria that includes Escherichia coli and Klebsiella species. These bacteria are commonly found in the environment, particularly in areas of total confinement or dry lots. Surprisingly, they're less common in pastured cattle. In well-managed, low somatic cell count herds, coliform bacteria pose the most significant mastitis problem. The rate of quarter infection is relatively low, between 2 to 4%, with the incidence highest in early lactation. Interestingly, coliform bacteria are opportunistic, meaning they seize the chance to cause infection when the conditions are right. And where do they find these conditions? Mostly in the cow's environment between milkings, during the dry period, and prepartum in heifers. Bedding materials like sawdust and shavings, particularly when they're wet due to rainfall or high humidity, are a major source of these bacteria. Now, how would you know if a dairy cow has been infected with coliform bacteria? In the acute stage, you would notice swelling of the gland, watery milk with small flakes, a mild systemic response, and recovery in a few days. However, in the peracute stage, the symptoms are more severe, with sudden onset of severe toxemia, fever, tachycardia, and impending shock. The cow might even become recumbent, and the secretions thin and serous. Culturing milk and measuring the somatic cell count are vital steps in diagnosing an infection. In severe cases, you might observe marked leukopenia, neutropenia, and a degenerative left shift. Bacteremia, the presence of bacteria in the blood, may also occur. So how does one treat coliform bacteria infections in dairy cattle? The severity of the infection dictates the treatment. In moderate to severe cases, the use of antimicrobial agents is indicated. Some infections become persistent if antibiotics are not administered. Severely affected cattle also require fluid and electrolyte therapy, alongside non-steroidal anti-inflammatory drugs for endotoxemia. Preventive measures are equally important. Regular cleaning of barns, maintaining dry bedding, avoiding crowding, and keeping dry cows on pasture if possible are all necessary steps. Replacing sawdust and shavings with sand for bedding is also recommended. In conclusion, managing coliform bacteria in dairy cattle is critical for maintaining the health of the herd and the quality of the milk they produce. It's a complex process that requires a keen understanding of the bacteria's etiology and epidemiology, the ability to recognize clinical signs, and knowledge of appropriate treatment and preventive measures. Remember, a healthy cow is a productive cow,